St Vincent's.
This is St Vincent's Hospital, one of the busiest emergency departments in Australia.
That's not sturdy, that's just continuously just running out.
Minutes away from Sydney's pumping city centre, the entertainment hub on Oxford Street, and the famous King's Cross strip. The ER sees people from all walks of life.
You really do see a huge mix of cases and of backgrounds.
You'll start the shift running. You're often juggling several things at once.
Always starts off with a ward round, always ends with a ward round, and then all hell breaks loose in between.
He's got a single stab to his left ventricle and my finger's on it.
It's a roller coaster.
Tonight on King's Cross ER, a bizarre accident on a building site.
He's actually hit an area where a lot of arteries join within the brain.
It's all hands on deck to treat the victim of a house fire.
House fire. No burn.
And a punch-up ends in blood, pain and tears.
Actually, I'd done a Mel Gibson and I really did throw it in off the wall.
Like all major cities in the world, Sydney's skyline is constantly changing. Workplace accidents on building sites are not unusual. It's 2:30 in the afternoon when a call comes in on the bat phone about a most bizarre case.
We have a 28-year-old male construction worker who has had a powered nail gun fired through a wall. He has penetration to the left side skull.
The emergency team prepare for a major trauma.
We've got plenty of fluid.
A case like this is exactly what Dr. Zoritza Tutul enjoys.
I just love it. You get to help people at their most vulnerable. They come in here, they've had something awful happen to them that's necessitated an emergency admission. You get to build trust, build a relationship and actually help them, help to figure out what their problem is and help them figure a solution.
This man needs to be managed carefully.
No, don't move your head, darling.
The nail is firmly lodged in his skull, so he needs to be kept still.
Okay, everyone ready? On 3, 1, 2, 3, but not too far, and that's far enough.
Okay.
Everyone have nice breaths ready. On 3, 1, 2, 3.
All right.
Okay, it's come from a building site today. He was standing there and a nail has penetrated through the wall and penetrated into his left temple. This is the size of the nail. We're assuming that it's gone in approximately 10 to 15 millimetres. There was no loss of consciousness, no motor sensory deficits that we're aware of.
It's possible that the nail has penetrated the man's brain tissue, so the team need to assess him quickly.
Just going to be a sharp sting in the left arm now. We're going to put a needle in, darling.
He's actually hit an area that's relatively close to an important area in the brain. That's where a lot of arteries join within the brain. So obviously we're concerned that he's going to bleed there or bleed on the outside.
Disability, pupils 2 equal reactive, eye movements all complete, upper limb tone sensation grossly normal. I haven't checked lower yet.
The risk is he could suddenly have a seizure. Clearly, it's a very painful injury.
In your head? Yeah, okay. He's also in quite a bit of pain. Do you mind if we give him some analgesic?
Yeah, so let's give him some morphine.
Just going to get you some pain relief, okay, Dylan? I'm just going to go into this little needle in your arm and I'll keep asking you if it's making any difference, okay? Because I think you probably need quite a lot of pain medication.
It is a relatively painful area because you've got obviously quite a lot of sensitivity around the head and on the skin, and then you've got the bony injuries, so it would feel like a break.
Just going to roll you, just have a quick look at your back. It'll take a few seconds. I'm going to hold on to your head, keep you nice and still. You're doing really well. So the good thing is at the moment, you've obviously got the nail in there, but you're still nice and awake, you know where you are, you're moving all your legs and you're doing everything you should be doing, okay? Roll on 3, 1, 2, 3.
You won't fall out, mate.
Is there any pain down here? Okay, it all looks pretty
Firstly, you want to know what damage the nail has done by itself, and then there's the damage that can happen from the body's response to that injury, such as bleeding or infection or any electrical activity in the brain causing seizures.
Zoritza checks to see if the morphine has kicked in.
I know this is going to sound like a daft question. If you had to rate your pain as out of 10, 10 being the worst pain you could ever imagine, whereabouts are we now on that scale?
They now have the pain under control. The next step is to get the man over to the CT scanner to determine just how far the nail has penetrated the skull.
We have to assume that the nail's gone in. We can't tell from just looking at him whether it has, and that's why we have all the investigations like the CT scans to help us with that.
With the latest scanning equipment available to them, the team swiftly get the answer they urgently need.
You can see the nail coming in here. You can see his hat, and you can just see here as the nail breaks bone and that fragment of bone here.
The pictures tell a worrying story.
The brain tissue looks intact. There's a little bit of bleeding possibly around here, but it's difficult to tell given all of the spray that the metal produces in the scan.
But one thing is clear.
The nail needs to come out and he needs to be covered for infection. He needs to be monitored closely. I don't know where they will choose to do that, whether it's down here or in theatre.
The man will be taken up to surgery to have the nail removed from his head.
Some water. I might just get you some ice cubes to suck on if that's okay, just in case they have to take you up to the operating rooms to have that removed.
He'll stay here for a few days. Initially, because it's broken the bone and you can see the internal layer of the skull, it's very, very close. So you want to make sure that once you pull the nail out that you don't get any bleeding that's going to occur, and we need to monitor the signs of that.
Put that in your mouth there. Suck on that for a little while?
Yeah, in a nutshell, he's been very lucky. He could have been luckier, he could have been not here, but if you're going to get a nail into your skull, then this is probably the best place for it to have stopped.
But lucky or not, it's a day at work this man is never going to forget.
We'll take the dressing down and see how you go, okay?
Emergency specialist Dr. Iromi Samrasinghe started out at St Vincent's Hospital as a medical student. She progressed through the ranks to a senior position on staff.
As a medical student, I actually wanted to be an orthopaedic surgeon, but one day in theatre, holding a person's leg that weighed more than I did, I realised that was not the job for me. So I took the next most interesting thing, and it turns out to be just the perfect choice for me.
Iromi is about to do a routine ward round before clocking off, when a call comes in on the bat phone about a man who's been rescued from a house fire.
We have an approximately 40-year-old male who's involved in a house fire. There are nil actual burns. His G-test of 3, query GHB overdose, not tolerating a Gadell.
A Gadell is a breathing tube often inserted into patients who are brought in unconscious. If the man has inhaled smoke, intubating him is essential so that his airway can be managed.
Why is he not tolerating Gadell? Try nasopharyngeal.
Have you tried a nasopharyngeal?
Probably not at this stage. We'll give that a crack on the way, thanks.
All right, lovely. Okay, thanks. See you soon.
I think it's still. Said something about a house
fire.
No burns.
No burns.
The paramedics' report is puzzling.
Cases of 3, normal intensive, tachycardic, normal BSL.
Query a G over
G. They're usually bradycardic with G. Yeah, so that's a bit unusual.
A GCS of 3 is a very low level of consciousness. Based on information gathered at the scene, paramedics suspect that he may have taken an overdose of GHB before his apartment caught fire.
All right, tube ready.
Yeah.
We'll have to cancel that ward round now.
Yeah.
The story isn't very clear at the moment, but they're suggesting that the man called 000 and then collapsed when the police got there.
The team prepare to intubate the man on arrival.
The primary thing is to get the airway secured and get some access so we can give him some medication to paralyse him and get the tube into him.
Okay, so on 3, 1, 2, 3.
Okay, so approximately 40-year-old male was involved in an apartment fire tonight. He has no obvious injury that I can see, and he's not responsive to the naloxone that we've given.
After taking blood tests, they quickly assess him for signs of smoke inhalation.
I can't see any nasal hairs, and there's no soot within his mouth. His pupils are about size 4 and reactive.
Heart rate's 107. What's his breathing like?
There's not much respiratory effort here that I can see.
Did you guys give
800 micrograms, right?
No change.
This is a worry. The Narcan should have improved his level of consciousness, but it hasn't. At this stage, the drug overdose theory is looking unlikely.
Hi there, what's your name?
Okay, squeeze my hand there, squeeze my hand. Good. Let go now. Squeeze this hand. Let go now. Can you move your feet for us? Good.
Hey, open your eyes for us. Come on, open your eyes. He's following commands, but no speech and eyes.
But despite his low level of consciousness, he continues to resist the breathing tube.
Didn't like that.
It's not making any sense.
These are particularly difficult situations. It's a stressful environment. We know we have to make sure the patient's safe and resuscitated appropriately. So there's a time-critical assessment that's needed. And we're not able to talk to the patient at the same time, which is very difficult because we don't know what his medical history is, what regular medications he might be on, what allergies he might have that we might accidentally give him something. So these are very scary times for us.
Coming up, the fire victim takes a turn for the worse.
Can you smell that? Oh, God, here comes the vomit.
Squeeze this hand.
A man has been brought into emergency after calling paramedics to a fire in his apartment. He collapsed on the scene. But since arriving in the ED, he's been in a state of semi-consciousness without being able to communicate.
Hey, open your eyes for us.
It's not clear if the team are dealing with a drug overdose, smoke inhalation, or both.
We haven't seen in his mouth, and we don't know that he hasn't got airway burns.
There's no singeing of the S double.
No.
Smells like it.
And all of that is
It's not, it's all dentures.
Of black little char.
Oh, black char at the top.
The soot in the man's mouth is the first clue that he's been affected by the fire.
The significant thing is that other than for a little bit of soot in his mouth, there's no signs of burn to his face or his airways. There's no singeing of his eyebrows or lashes, and no evidence of burns to his chest or arms. So there is no other sign of injury either, like there's no trauma that we can see.
He continues to resist sedation. The results of the blood test come in, but they failed to shed any light on the case.
There's no acidotic, not CO2 retaining, and he's not hypoxic.
The team attempt to sedate the man further, but it only seems to agitate him even more.
That's all right. Maybe a little bit
Just
more
in
fire
hospital.
Another 125 of fire.
Eventually, they manage to get a tube in.
Bit of wheezing, but otherwise good.
Oh, he's breathing out some pretty strong smoke, isn't he? Yeah, can you smell that? Oh, God, here comes the vomit. Well, I'll have you off to sleep in a minute. He vomited up a whole lot of black soot, so he's likely to have inhaled and actually taken into his stomach some of the smoke that was in the room.
Iromi should have clocked off a long time ago. She hands over the case to Dr. Kirsty Short, who's come down from ICU.
Dr. Short, how are we? He's got what looks like to be some evidence of charring.
The black particles in the breathing tube indicate that not only has the man ingested soot, but he's also inhaled smoke.
Our main concern is that he's had an inhalational injury, so that there can be swelling and what we call edema around his vocal cords and around the top of his airway, and that can get swollen to the extent where it can block off your airway. What's the propofol running at the moment?
It was at 30.
Oh, really?
And we've probably given him in the past hour upwards of 15 boluses.
Just going to bolus him 5 of propofol if it always more from dad's up.
But even with more sedation, the man remains unsettled.
Have we just got any neat Medaz? I'd rather not paralyse him if we don't have to, because I want to see what he's doing neurologically. The concern is that now that he's starting to wake up, that he'll actually pull the tube out himself.
All right. He's just pulled out the slide.
Is he?
Oh, that's the Medaz line.
Give me that.
That's
and
out
I've got
anyway.
this.
That's not working.
So it's come out?
I've got this line here.
That's not working.
Can someone give me some, well, let's just give him some rock. Okay, can we just paralyse him? Okay, we've just lost all axes apart from one, and he's very, very, very light. So I'm just gonna. I need some. If anyone's got some propofol, just drop.
I've got some rock. Yeah.
Yeah, just give him, just paralyse him, and we'll have to sedate him off. Brilliant, give it all in. Brilliant. And then if someone, can you just attach the morph with Dad? Okay. Let's bolus him 5 again of that.
Finally, they managed to get the man sedated. Now, Kirsty can make an assessment.
It looks like the primary reason for him actually having this collapse was because of really low oxygen levels and high carboxyhemoglobin levels. He needs to go to an intensive care unit, and just to really see what he does neurologically once these sedatives that we've now given him have worn off.
Kirsty also has a theory as to why it was so difficult to sedate him.
So there's a suggestion of intravenous drug use in the past, and that can raise your threshold to these sedative medications. We often find that a lot of the drug users, whether it be sort of intravenous drug use or sort of regular oral drug use, their tolerance for these sedative medications is a lot higher than the regular population.
Girls spend maybe 2-3 hours getting ready for a night out, and then when we see them, you know, the makeup's all down their face, the hair's in front of their eyes, often their skirts are ridden up and you can see their underwear. But yeah, it's a bit of a contrast to how they began the evening to how they end up.
Oh, careful there, high heel shoes.
We give them some fluids and try and sober them up a bit more and make sure that they're safe to go home with either parents or other friends. But often the other friends are also intoxicated. And a lot of people come in saying that they will have had their drink spiked or something, and often don't really realise that actually it's just the volume of alcohol that they've consumed that's led to them being incapacitated and not remembering anything from the previous evening. Young girls have to be really careful when they go out on a night out. You know, if you get too drunk that you don't know what you're doing, you can be taken advantage of. People are losing their wallets, phones. You're putting yourself in danger from other people as well who maybe aren't as safe as you would think. I'm a normal person, as is everyone who works in the department, and most of us would go out and have a good time on a night out, but I've never ended up in an emergency department after too many drinks. I think there's some people know their limits a bit better than others.
Registered nurse Carly Ringer often finds herself working the weekend shift in emergency, so she knows the territory well.
So on the weekends, even from Thursday onwards, we get a lot of intoxicated people throughout the whole night until the early morning. A lot of them fall over, assaults, anything like that.
Tonight is no exception. Paramedics have picked up a young Irishman who's been drinking with his mates and come out on the losing end of a fight. After throwing a punch, he's managed to throw out his shoulder.
And he's dislocated that same shoulder before?
Yeah, dislocated in the past for the exact same injury, throwing a punch.
Sorry, Gavin, just having a look at your arm.
No, you're all right, you're all right.
Have you had any surgery to it?
No.
Can we cut that shirt? Is that all right?
I'd rather you didn't. I can take it off if you want. Like,
you might have to do some serious nappy sanding to get that blood out. But
is there clotted blood?
There's a lot of blood, but you could try soaking.
Oh, Jesus, I'm
Good
destroyed.
Aside from ruining his favourite shirt, he's also done a great job on his face.
Is your nose normally that swollen? Maybe not. Just look this way for me. Not this way.
Am I still sneezing blood?
Not anymore.
It wouldn't
Any
be
pain in
broken.
the face?
No.
What
no
about your
pain,
teeth?
no.
Clench them together, do they feel normal?
Teeth are grand.
Yeah? Okay.
It's shoulders in an awful bad way.
No pain down here anywhere?
No pain anywhere.
Little
No.
kick there? No? Beautiful.
I don't have a broken nose, do I?
A bit swollen.
Swollen like it's. Can you tell if it's broken from your point of view? No.
Pointing the right way, at least.
It's not off to a direction.
Lovely. At least it's not pointing the wrong way.
He's definitely been hit in the face, as you can see by his swollen nose, but he hasn't blacked out. He was awake the whole time, could remember everything, so it's not too much of a worry regarding the head injury.
First, Carly needs to get his history, and it's a colourful one.
What did they do for your previous shoulder when it
The last time I dislocated my shoulder,
Yeah.
you sound like an asshole here. I was on a train and ended up in a fight, and I threw a punch and missed, and threw my shoulder out and got a hiding by maybe 6 people.
Did you have to go to hospital and have it put back in the last time?
Actually, I'd done a Mel Gibson and I really did throw it in off the wall and it worked.
Did you try that again tonight?
I did actually. Had a few people pull the arm, but then I realised it came out from the other side this time. This is underneath, dislocate. Last time was above and it worked. It's not unpainful.
But while the lethal weapon method of relocation works on the screen, it's not a recommended medical procedure.
You can actually cause a lot more damage by doing it. It's not an easy job to put the shoulder back in, and you're at bigger risk of hurting more and for the shoulder to dislocate a lot more in the future.
Before she can give him any pain relief, Carly needs to know how much alcohol he has on board.
How much would you say you've had to drink tonight, Gavin?
15 pints.
15 pints? Yeah. Good job.
While the alcohol can dull the pain, it can often enhance the patient's story.
No, I'm not the guy that's going to start a fight, but I turned around and was broke up instantly. And then I threw a punch back and missed again and threw my shoulder out. And of course then I had no hope. What you gonna do with one bad arm? You're gonna get lobbed around. That's what happens.
With the alcohol beginning to wear off, the patient is really starting to feel the pain.
I get something with the pain now.
We're just getting you organised now, Gavin. We're trying to get your bed, get a doctor to see you, organise you something for the pain as well.
I'm for the pain, just put my shoulder back in.
Coming up, the feisty Irishman worries about losing his looks.
My nose isn't broken though, is it? It feels like it's halfway across my face.
21-year-old Irishman was meant to be having a quiet night at home. Instead, he joined some mates for a drink and after 15 pints, ended up with a dislocated shoulder.
Supposed to be home by maybe 12, 1 o'clock. As you can see, that's not going to happen anyway.
Dr. Anthony Van Ash checks out the injured shoulder.
Hi, my name is Anthony, one of the doctors. Can I just have a quick look there?
Yeah, all right.
Can you feel me touching you there?
Yeah.
It's not numb there?
No, all right.
Can you move your fingers at all?
I can move everything.
Good. Excellent. It's okay. Seems to be dislocated again indeed. I can feel the step. Okay. So you didn't really fall on it, did you?
It was
basically
fall.
from
One of them.
Yeah. So it probably won't be broken. It will be just dislocated.
No, it's not broken.
Righto. Okay. We'll take some X-rays and I will see if we can put it back in.
Is there any way you can put it in before you do the X-ray?
Yes, that's something else we can do.
Yes,
Absolutely.
please, because I can feel it hanging there. It's not back in anyway.
No, it doesn't look back in. No. So what we'll do is we'll pop a little drip in your arm. We'll give you something for the pain. Right?
He's going to need some sedation to put him to sleep because it is a painful thing to do. So we'll have a look, see how we need to do it, give him some sedation and then relocate it. You can't do that if they're awake because as you move the shoulder, the patient will jump and move and thrash about and you need them to be completely still for it to be done properly.
My nose isn't broken though, is it? It feels like it's halfway across my face.
So we're going to give you some propofol that can sting in your arm. It's basically something to pop you asleep.
Propofol is a short-acting hypnotic agent, which means that the Irishman will be awake again in 15 minutes and he won't have much of a hangover, except possibly an alcohol one.
So basically just actually put a little bit of traction on the arm and try to lift it up at the same time. And you just feel a little pop and then it goes back in. It's back in. Yeah. All right. So that was enough, just a little bit of traction and vertical uplifting and then basically just the shoulder is back in. So it doesn't need a lot. So it's important now actually that we keep the shoulder nicely immobilized for a couple of days at least. So he'll get a sling from us. It's all done.
Once he's fully awake, Anthony will assess his other injuries.
Need to have a good look at his face as well. I think it will be all quite okay, but it doesn't say that there's any significant pain to the facial bones. He obviously had a nosebleed after he was punched, but his nose seems pretty swollen, but it's not deviated to one side. It's all finished. You're in hospital, it's all okay, it's all okay. Probably will need a bit more pain relief. He will need to wear a sling for at least a week and then see a physiotherapist as an outpatient to get some exercises for the shoulder. He's a young man with a second shoulder dislocation now. He might need an operation at some stage.
What started out as a quiet night has ended in a busted shoulder, a bruised nose and a ruined shirt.
So you got some happy drunks, you got some sad drunks, you got some funny drunks and you also get some very angry drunks. He's actually been quite fun and entertained us for the night, which we like.
Next time on King's Cross ER, coming down hard.
You were bashed. We need you to lie still until they've assessed your neck.
A new mother gets a nasty surprise.
Was basically laying into a big dog that was attacking my dog.
And treating a traffic accident trauma.
Maybe distinguished.